Yeah, I'm Mike Dyer. I'm an RN, and I've been an RN for 21 years, and I came here from Washington State in the Tacoma area.
Yeah.
Hi, I'm Diane Sosny. I'm a registered nurse for 37 years from Seattle, Washington, and I'm the president of SEIU Healthcare 1199 Northwest, and came to Iowa to work on the presidential campaign.
Okay.
My name's Corky Lacey. I'm an LPN. I've been an LPN for 28 years, worked 20 years in long-term care and now home health and hospice.
Okay.
Came here to Iowa because nurses need a voice, all
Okay.
nurses.
So what else motivated you to come all the way to Iowa to help out with the campaign here?
That's a tough question because I've been politically active for quite a few years. I just got to a point where I came to realize that nursing really is politics. Everything that we do is controlled by our government. How much, the wages that we get, the amount of health care that our patients can afford, medications, needle stick, safe staffing, all these things are controlled by the government. And unless I speak up, my question is, who else is going to do it? So I'm doing this for me and for my family to make sure that we have a voice.
Of the list.
Basically the same reasons.
Mhm.
Lots and lots of issues out there. And nurses need to be involved. You need to be, if you're complaining about your wages, you need to be involved in getting those wages increased. And the only way you're going to be involved is by having that voice to elect candidates that are going to help you get those things that you need for your family, for your neighbors, for your patients, most especially.
I came to Iowa because I think it's very exciting to be in the first state that's going to help determine who's going to be the nominee for the presidential elections. And I'm from Washington State, and so even we're not first up. So I thought this would be a great opportunity to come and really make a difference in who is looking at the issues in the highest office of this country. I have come to learn over the years of my work in nursing that even though we have a largely private healthcare system with a fair amount of public healthcare as well, that the dollars that fund healthcare are predominantly public dollars, either state or federal, through Medicare, Medicaid, and to influence the policies that decide how those dollars are going to be allocated and spent takes electing to office people who prioritize and care about quality health care. Nurses are really on the front line of advocating for patients and making sure that patients get what they need and get quality care. And we, I think, not only need to advocate for our patients in the exam rooms, in the hospital rooms, at their homes, but we need to do it in the public arena in terms of electing candidates to office who will prioritize these issues as well. So I can't think of a better place to be this last week of the year, the new year, and to be here to celebrate the new year with helping to elect a new president.
Great.